Welcome everybody to our fifth session of the STAR program. Just again, if anyone hasn't had a chance to fill out the attendance form, there's the QR code on the screen to scan it for a virtual copy, or there's some paper copies by the end. Right, so before we start today's session, I'd like to take a moment to acknowledge the sacred land on which University Health Network operates. For thousands of years, it has been the traditional territory of the Huron-Wendat, the Haudenosaunee, and most recently, the Mississauga Secretariat. This territory was subject to the Dish with One Spoon Long-Home Covenant, an agreement between the Haudenosaunee Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably care for the resources around the Great Lakes. Today, the meeting place of Toronto is still home to many Indigenous people from across Turtle Island. I'd like to share this on another upcoming event that we have. This is a popular one that I'm particularly excited for. So we have a therapy session coming up on August 7th in Toronto General Hospital. So if you're interested in by, bring with some puppies. But a good place to do that. So there's a QR code on the screen where you can register to have a spot to come for the therapy. Next, I'd also just like to take a quick moment to remind everybody that the deadline to register for the research day is coming up on Monday. So if you would like to participate in research day, please do register for it. Next, I'd also like to share a really cool limited opportunity that we have happening on July 30th from 9 a.m. to 11 a.m. There are limited spots for a tour of the Challenging Environment Assessment Laboratory, or CEAL, here at Height, and followed with a networking session. So if you're interested in taking a tour of CEAL, there's really cool labs of the labs that they have downstairs in this building. There are 17 spots that are available and will be selected by a lottery system. And if you're here today, you'll have to really give preference for that tour. So if you're interested, you can scan the QR code to fill out the expression of interest form. In a moment. The link will also be in the email after today's session. Couple phones. More phones. Okay. All right, so just a couple of overview for today's session. As always, the recording will be shared in an email early next week with a recording for today's session. So the way that today's event is structured, so first will be a 40-minute moderated discussion with our panel, we'll introduce in a moment, and followed by a 15-minute question and answer period. So think of all the questions that you have, you'll have an opportunity at the end to ask questions. And lastly, this is a safe space, so you have to all participants remain respectful and follow the order keys. All right, so today we are joined by a panel of three in really cool positions in research and healthcare here at UHN. So please join me in welcoming Natasha Dixon, the analytics lead within the social medicine program. Nikima Ramsey, an occupational therapist and educational development lead at the Professional Development and International Center for Education. And lastly, Matthew Clifford, a physician assistant at the Toronto Western Hospital. I will stop sharing the screen and we'll jump into the discussion. What's awkward, so I'm not standing too far away. All right, so I guess we just jump into the questions. So the first question will be, could you introduce yourself further, your career, your education path, and what do you do in your current role? Maybe I'll start with Matthew.
Hello. Hello.
Yes.
How's it going, guys? Thanks for having me. Great work, Matthew. So my name is Matt Clifford. I'm a physician assistant in University Health Network, specifically at the Toronto Western cardiology unit. So the inpatient unit and both the wards with 12 beds, as well as the console throughout the hospital. Just quickly, so the PA role is a little bit new still in Canada. So for anyone who doesn't know, physician assistant is very much the physician expander. I work alongside a group of physicians. And the whole purpose behind it is obviously our healthcare system, there's a lot of issues with wait time, accessibility and things like that. So the whole idea of the role is to make healthcare more accessible. Working alongside a physician, I can diagnose, prescribe, and treat, as long as I'm in essence associated with them, you can see that in more patients. Yeah, so I started my education at Carleton University. I did a bachelor's of health sciences there. After that, along that way, I heard about the PA loan. I knew I was interested. So I went to the University of Toronto for it. Before that, before COVID kind of ruined everything, as I'm sure you're all aware of, needed about 900 hours of healthcare experience. So following my undergrad degree, I stayed in Ottawa for about a month. I helped implement the EPIC EMR there. So I was there for about a month. After that, I came back home, so it's originally from Orillia. I worked with patient transfer service with the Voyago, just one called R&R. And after that, I worked at Shoppers Drug Mart just as a pharmacy assistant. Get as much healthcare experience as I could to make my application stronger. Thankfully, I was able to get in on my first attempt. Went to UT for 2 years. First year is all active. And after that, we do 10 rotations in the second year, split between Southern Ontario and Northern Ontario. So I did about half of it in the Orillia area, and after that, they shipped me up to Thunder Bay for 5 months throughout the winter. So, yeah, so that was kind of my education path, and then ultimately led me here to UHN, where I work in the cardiology unit now for about a year and a half.
Hi everyone, so my name is Nikema Ramsey, and I've been working with UHN for 17 years now, and I'm an occupational therapist by background, and I've primarily been within the same setting, so I work in inpatient by brain injury, and in the role of occupational therapy, in case you're not familiar or aware. So we work closely in a collaborative team with physiotherapists, social workers, doctors. We have therapists, and we also have an assistant group, but our role primarily is looking at giving people skills to get back to the job of living. Lots of people hear occupational therapy, think we just work, but that's kind of the context that we speak of. It's helping people get back to the things that they need to do, and they want to do, and they have to do after an injury or illness. And that role can really change depending on the area that you're working in, whether it's in a hospital, whether it's a school setting, or whether it's private practice, but the role can be shaped to kind of what your interest aligns with. So lots of possibilities within our occupational therapy realm. So in regards to my practice, I mentioned I've been here 17 years. I recently transitioned into a new role, and I'll speak to that a little bit afterwards. But in regards to my school history, I did my undergrad at University of Western, which is called Western University now in London, and I did it in health sciences. It's a 4-year undergrad program. And then from there, that was my second year. I was just like, oh, what's next? What am I going to do? And it wasn't until my roommates, and we actually went to high school together, and she knew a clear path. She's like, I'm going to be a physio. She had a lot of family that were physiotherapists, and I kind of looked through the academic calendar and reading about physiotherapy, and I'm like, okay. Interesting, and I was like, okay, and then my eyes peeked over to occupational therapy, and that's how my eyes got thrown into occupational therapy. So I read about it in their calendar, and I think that draws me to it. But then it's a very holistic description, a holistic approach. And then from there, I spoke to my aunt. I'm like, do you know anybody? She's my aunt's a nurse, and she organized a few shadowing opportunities for me, and got a chance to see her in action. And then from there, I said, you know what, this is really what I want to do. So from there, I kind of dedicated all kind of like my courses and everything to the boutique program. And then the next stage for me was doing my master's assigned in outpatient therapy at UT for 2 years. And it's a clinical master's program. And that's kind of my journey in regards to like formal education. I would say there's always opportunities for professional development and learning throughout that I've done throughout my career as well. With mentorship programs, again, supporting those program at UT, leadership opportunities as well. But I would say in regards to career itself, so I mentioned 15 years of my journey has been in the inpatient setting here in this building. So it's on the 10th floor. It's inpatient API, working primarily with individuals who sustain injury. And most of it are focused on cognitive impairment and helping them get back to life again and transition to home. And then throughout, like I said, through there, have a lot of leadership opportunities for supporting the program itself. And then I actually moved into another role where I was kind of clinical part-time, and then I had moved to a role of supporting OT practice, occupational therapy practice as a whole for all of the University Health Network. So in that role, I was close with another colleague, and we would support moving professional OT forward, dealing with issues that came up with the profession, and really helping people to guide and shape what OT looks like at UHN. And then more recently, as of June, I transitioned into a different role, which is not clinically based. This is my first time out of clinical work, and I'm working as an education development with UHN, and I'm supporting professional development. So it's looking at professional development opportunities for all of UHN, what does that look like? So some of you guys are looking for mentoring and shadowing opportunities. And the other half of my role is supporting International Center for Education, which really looks at supporting individuals for international training. And that's where I am. So I am still new to that role, still learning, but similar to you guys, looking at interest and passion of what aligns. So very big to.
Hi everyone, my name is Natasha. As Jordan kindly introduced, I'm currently at UHN and my role is the analytics lead. And I'm a member of UHN's data and analytics department, but in my role, which is a new role at UHN actually, I exclusively support all of the data and analytics requests and needs of our social medicine program. And I don't know if any of you folks are familiar with social medicine. It is a bit of a newer program at UHN, but it started a few years ago to address the social determinants of health for UHN patients who have multiple, usually complex health conditions and complex social conditions. So many of the patients that we serve are insecurely housed, experiencing homelessness, like living in encampments. Many of them also come to UHN a large number of times. So visit the emerge department quite often. So the program is set up to better support these patients and see what UHN can do to better support both their health and their social needs. So we have a few kind of programs under that umbrella, including pairing patients with a community health worker who can support them with, of course, their healthcare appointments, but also applications for social programs and other kind of more life-related things. And we also have a housing initiative that has been in the works for a few years now, but it's opening and it's opening this fall with tenants moving into permanent supportive housing. We're then also paired with a health worker and will also have access to a nurse practitioner for their primary care needs. So that's what social medicine is, and it's a new program which has expanded rapidly, and one of the roles that came about with the expansion was this analytics lead program role, which I have been in for almost a year now. And a bit of what that entails is, as it suggests, looking at the data from all of our programs, looking at patient data for our patients or other UHN patients that might benefit from our services, and essentially supporting all of the data and analytics requests and needs of the program. I guess we'll speak about more when we're asked about our day-to-day. But in terms of my, I guess, education, I did my master's in cancer immunology at Queen's. And then I thought that pipetting was like not what I wanted to do for the foreseeable future. And I wanted to do more as hands-on work. So then I moved out west and did my master's in public health, specializing in the social inequities of health at Simon Fraser University. And that kind of really piqued my interest in looking at like the social determinants of health and how they really influence the overall health and well-being of everyone. And then after graduating, I worked at a few jobs. I worked at a private consulting firm, a really small one based in Toronto, which worked with a lot of like social service agencies and nonprofits. And then moved to after about a year and a half there, I moved to the Canadian Partnership Against Cancer, which is a federally funded public health agency that funds initiatives across the country focusing on like cancer prevention, cancer screening, and cancer care. And then here, so that's where I am.
So thank you for the great answers. So the next question, I might start with Nikita this time, is mention how looking through the book you held on page 130 jumped out at you. So the question is, what inspires you to pursue this career? So you want to expand more on that? Yes.
So I think really throughout, even like growing up, like I've always been like that helper. Like my mom, you know, never leaving anybody behind, like, you know, I can tell you the story of how, you know, we lived in an apartment when I was younger, and I had a split class, 1-2 class. And my mom said I didn't want to leave anybody else, so I invited the whole grade 1-2 to my birthday. And we're in this like 3-bedroom apartment. Lived in there and we celebrated. It's all about like caring and helping and empathy. And like I said, when I read the description of OT, that kind of really drew me in. That's really the core of the profession. And like I said, it doesn't matter where you are, the principles of what OT is and the values of OT is really wherever you are. Even as you transfer to different roles, the business, all those values translate with you and translate to what you're doing. I think that essence of me being a helper and wanting to really serve in a way that I could actually help and serve the client.
Yeah, you know, very, very similar, you know, growing up, I always wanted to be involved in medicine. I always wanted to care for people and help people. I think the idea of someone coming to you quite sick and needing help, being a bit of a problem solver, using whatever diagnostic aid you had, to make a diagnosis, treat someone, see kind of through the course of their illness. Until they're able to walk away from, for example, a hospital feeling well. I think that was always, it always just piqued my interest, and with science and everything growing up. I always thought, you know, going to university, I figured I'd always go down the medical school route. I was very interested in that. People asking, I have no idea where I heard about the physician assistant program or and then role from, but at least somewhere probably within the first year I heard about it. It sounded very interesting. Specifically, some of the main points for myself is that, like I did that earlier, the schooling itself was 2 years, as opposed to medical school, which is obviously 4 years. And then after that, in residency, things like that. The flexibility of my role is also quite interesting in that we're trained as generalists, and after that, I can go into specialty in like. So for example, I went to cardiology straight out of school. For whatever reason, if I didn't like cardiology tomorrow, I could flip into emergency medicine. If I didn't like emergency medicine, I could do family practice. Wherever a physician is, a physician and working involved. It's not my cup of tea, some PAs work in wards. So that itself really drew me in as well. And especially the work-life balance. You know, physicians will be a little bit more of a structured routine. You know, I work 8 to 4 Monday to Friday. Whereas I know on the contrary for people, physicians, you know, kind of want to clock around the clock. And work-life balance myself is always very important. You know, extracurricular, spending time with family and what we love and enjoy outside of work is very important. So for all those reasons, you know, I pursued physician assistant. And like I mentioned earlier as well, the role itself is still quite new. When I applied, going through school, there's only about 600 across Canada. At the present time, probably about 800. And same thing when I started, so the University of Manitoba, Master UT are the only schools in Canada that offer the program. At present time, University of Alberta is going to be opening up one soon. Dalhousie will be opening up one this year. And I believe Queens is now opening one as well. So it's kind of the idea of being a pioneer in a career. And being able to trailers that profession really into whatever it can become. And I saw that opportunity and all kind of pieces aligned for myself, and I figured that was the best fit for myself.
Thanks. My answer might be a bit different. I mean, similarly, I also have been interested in kind of health and medicine. But I wouldn't say, like, especially in undergrad, I had a defined like career in mind. Kind of I don't want to say, I just like bumbled through. But I tried to remain like open to opportunities and learn what I like to do and what I didn't like to do. So for like during my master's of science, it's like, oh, okay, I don't feel the like satisfaction of doing this that I know some other people do. Like, I always remember my PI, who was super great. She would come into the lab so energized and say, oh, you know, Natasha, I was thinking about your protein pathway like late at night, and I was wondering what, and I was like, okay, cool, I never think about my protein pathway late at night. Which is great that you're in that role and enjoying it, but probably indicates that that's not something that I want to do long term. So when looking for kind of what to do, I was drawn to the MPH program, partly because it was quite broad in that it, well, there was a practicum component to get some hands-on work, but also kind of the areas that people go after are like really, really broad, depending on what their interest is. So some people go into more like quantitative, like epidemiology. There's also like opportunities for evaluation work, like program coordinating, program managing. So I thought it would be helpful for determining like what I wanted to do. It wasn't because I liked a bunch of different things. But it was through that experience that I got some experience doing kind of evaluation work. Because there was like a case competition for graduate students that I participated in. And then when I was then looking for jobs, I was like, oh, like I enjoyed kind of that experience. And I wonder if there's any like, you know, companies that are hiring. So it's kind of through that I got connected, and if like me, you're maybe not sure, I do recommend, I found it really helpful to be at a consulting firm. To kind of start things off, because that gave me exposure to different organizations, different work, and just a really wide variety of different projects. So it was through there that I learned, oh, like, I really do enjoy doing more like quantitative data collection, analysis, and reporting. And I like, you know, qualitative work as well. And because some of our clients were in the social sector space and others were in healthcare, I was like, oh, I do miss like focusing exclusively on healthcare. So I know that I want to continue with that moving forward. So that's maybe a help, like a tip if you're not sure, like consulting, you can get a wide variety of experiences to help you maybe narrow down what feels best for you. And I think I'm really, so far my job at UHN has been my favorite job so far. I think because I'm really drawn to the mission of social medicine, and finding new solutions in healthcare for patients who we know that the current system isn't working well for them. And it's been like a chance also for me to kind of expand my quantitative and data visualization and data analysis skills, which I really enjoy.
I must say, I agree with you both. My gene regulation pathway did not keep me up at night when I was in my master's. So I do. I think we'll jump down a question. So the next one is, what are some of the biggest challenges you faced in your career, and what have been some of the most rewarding moments?
You know, obviously I'm relatively new to the profession. I've been here for about a year and a half. I think sometimes one of the challenges that we face, I think maybe in this room, is that, you know, not many people know what a physician assistant is. And oftentimes meeting the patient, you know, they have a lot of questions, who are you, what's your role, things like that. In school, one of our projects was do an elevator pitch. As you an elevator pitch, I'm pretty much have not memorized at this point. But also on the other flip side of that, one of the things that brought me to the career, advocating and being, you know, respectful, also people to know what my profession is, and being able to make a difference in healthcare. So the next time when you encounter you know what that is. Ultimately, though, when I was thinking things, you know, to prepare for this question, one is the patient passing away. I think it's something that you never get used to. You obviously have family and friends around visiting patients. Oftentimes in the nature of cardiac disease, it comes out of nowhere. For example, heart attacks, someone get healthy, they thought for 30 years, and all of a sudden really emerge, chest pain, being told they have a heart attack. we try our best, and we do everything we can, but the truth of the matter is that regretfully, times people pass away. And I think every time that someone does pass away, it's a good reminder, just how fragile everything is, but also how much of a difference you can make. The do see improvement forward and do, are able to walk their life. I think, that leads into the most rewarding part of my job is exactly that, when patients are able to walk out of the hospital healthy, back to their friends, back to their families, and able to live, the life that they were previously or close to it. For example, at Toronto Western Hospital, we often have times that patients are having heart attacks, STEMI, for example, so at that time they have about 60 minutes to really get an intervention to save their heart muscle, or at least the proportion of their heart muscle that's affected. So we get a staff gauge overhead, cardiology, emergency department, I'll run down, oftentimes, we look at the diagnostic, aids in front of us, blood work, ECGs, things like that. Regardless, families often quite shocked, whether they're tears, calling from family members, and quickly rush them off to Toronto General Hospital, start cath labs there. And they'll get stents put in, and then a day later they come back and they're doing better. And it's sort of reward of seeing the full cycle of care, seeing someone come in, whether everyone's afraid they pass away, and not necessarily knowing what the outcome's going to be. And then, whether it's making sure they're on all the right medication, all their needs have been addressed, prescriptions written, things like that. And then they leave the hospital, and it's rewarding being a part of that care, and helping in that process. I think every day I'm very fortunate to be a part of that.
I would say, definitely some alignment with knowledge of our role. So occupational therapy, often, people don't really know what the profession is. It's often, are you a physiotherapist? And after you go through your spiel, we have an elevator and she explain their role, even after them to stay for some patients, just like, so what do you do again? So it's always re-explaining. I would say that's been a challenge throughout some of what you said, Matt. But I think the biggest thing that I've noticed over my career is really trying to do more with less. Natasha touched on this about the limitations of the healthcare system and really the pressures that exist. And, you're there, you're on the front line, and you see the issues, but the resources don't exist to address it in a way that you would like to. And I can give an example in the area that I work in. When I first started, patients would stay with us for about 4 to 6 weeks on average. Sometimes patients stay 7 weeks, 8 weeks. And as of today, on average, it's about 2 to 3 weeks. Right? So you're really trying to meet the goals, set people up for success, the transition from hospital to community. But then the next stage is that community is also not resourced, right? Family members are working full time. How are you helping to help them figure out what resources to support and how to care for their loved one to meet the needs when someone is not back to fully functioning, but they are living with some level of disability or impairment. So I would say that's probably the biggest challenge, and it's always about being creative and figuring out ways to kind of meet those needs within a constrained system as well. I would say rewarding, as you said, outcomes, the patients, seeing the transition, seeing the improvement, all of that is very rewarding. But what I would say is the team. I work with an awesome team, and the team has changed a lot for 17 years for sure. But the core has remained the same. I mentioned we work with physiotherapists, speech therapists, social workers, field care managers. And it's really just a team of everyone who's working towards the same goal. And I think once you're able to find a team that you can just gel with, you collaborate with, and it's really a seamless machine to really work for the best patient outcomes. I think that's been the most rewarding for me. And I've been working more remotely over the last month and a bit. So I haven't actually seen my team. So I actually went upstairs and connected with everybody. And then it's such a difference working a bit more or isolating really in a remote world versus working with the team in person. And I think just really recognizing the value of that and being able to kind of get back here and connect today has been awesome. So that's most rewarding for me.
Thanks. I'll speak to, I guess, a recent challenge, and then the flip side is the reward in my role. So I mentioned the social medicine housing initiative, which has been under construction for 3 years with multiple delays. And as I noted before, social medicine is a relatively new program at UHN and has kind of rapidly expanded the team, which is great. But the flip side to that is that sometimes it can be challenging without kind of established processes or ways to do things or standards like SOPs. We're often trying to figure out how to do things for the first time because it's never been done at UHN before. Which is exciting and that there's opportunities to like develop and move forward and really influence what the program does, but then sometimes it can feel a bit chaotic and a bit like, well, who's planning this and what's the timeline? And we're working on that as a team, and we know that that's an area of opportunity for us. But that meant that when it was time to start recruiting and reaching out to patients who might be eligible for the housing initiative, in that they had complex medical and social needs and were also currently experiencing homelessness, it definitely felt like a bit of a scramble to get that underway. And then to also meet the targets that had been set by executives in the department. Because they wanted us to have consents for 51 patients because there are 51 units, and it's quite challenging to connect with this patient population. So it was just a challenging and it felt quite busy for a month or so during that time. But then the flip side of the challenge is the reward. So I guess maybe differently to the other two panelists, I don't work directly with patients. I have had the opportunity to shadow a few appointments, but I know that the work that I do will eventually trickle down and support our patient population. So when we were looking at the housing initiative, which patients might be eligible, it was like my work and my analysis that led to like a list of names, a list of numbers, and other information about these potential patients. And I found that quite rewarding, knowing that, of course, there's like other work to be done and it's a process, but I had a really big role in determining, getting someone off the street into permanent supportive housing. And that's a life-saving intervention. People experiencing homelessness have a life expectancy about half of what people who are housed have. So just knowing that I had a role in that, and of course in our other social medicine programs, is one of the very rewarding parts of my job.
Awesome. I think we have time for maybe 2 more questions before we jump into the Q&A for your turn to ask questions. So the next one I'll ask is, what technical and soft skills do you consider to be the most important in your field?
Definitely. I think obviously, a lot of terms come to mind for that question. Teamwork, obviously, we're all in different roles and we all work, whether directly or indirectly, it's critical to any part of healthcare. Empathy, problem solving, communication, all those things are very important. I think the most important in my mind is the willingness to learn, and the understanding that you don't know everything and you never will know everything. Going through my program, and now I work very closely with the group of residents that come through every month after in the residency, and you do notice a difference in people that have that understanding that medicine is forever changing. What I know now will not be what is known and proven to be known in months to years, and you have to be open to learning. And you're never going to be, blank on the term, you're never going to be put at fault for not knowing something or asking why. And I think that pursuit of knowledge is a main part of medicine, and without it, I think oftentimes you disadvantage, at the end of the day, you disadvantage your patient. Whether you're going to be training again, med school, PA school, occupational therapist, any sort of school, be open to learning. The more you're guarded, the more you think you know everything, you're missing out on an opportunity to learn and take that forward with you. I think that's my biggest piece of advice, but also the biggest skill that is important.
You
go first next time.
I think in regards to technical skills specifically, I wouldn't say there's a lot of technical skills per se, like in regards to the technology that we're using is more so with our documentation, electronic medical records, things like that. But in regards to what I would add to anything that you said there is said, an openness and a mindset that is willing to adapt and pivot to changes. Because as you said, things are ever evolving. And once you become stagnant in what you're doing, that's when you don't really see progress. And I can speak from personal experience, like I didn't make a change in my career and tried to be different for 15 years. I was really afraid of change and really doing something new and different. Getting out of the comfort of really being really a good person who's knowledgeable about my role, what I was doing day to day. And finally, after 15 years, I was like, you know what, it's time to really feel the need to try something different. And I did. And now I'm just like, I want more and I want more. And like, there is that comfort in change as well. So I think just having the mindset of being ready to evolve and shift and change as needed. And I think it'll serve you well, in whatever future career you decide to get into.
Thanks. From my perspective, in terms of technical skills in data analytics, there are some technical skills, which I think vary based on the type of job, the institution, and what's available. So at UHN, I have team members who then specialize or prefer using different tools just based on experience and preference. So there's one guy in particular on my team who loves Python and does all of his analysis and cleaning and data cleaning in Python. There's some other folks who are also very well experienced with R, SAS. My preference is Power BI. So any of those skills I think really are helpful to pursue and to continuously improve. Like as mentioned, there's always new things that the programs are adding, like new capabilities, also new programs that have become more and more important. In terms of soft skills, I think it's important to, I know it's kind of cheesy, but I think just trying to have fun and enjoying the process. Because it's been years of a career, and I remember on like a really busy time, it was like, whether I'm feeling anxious and like stressed, or whether I'm just trying to like go with the flow and have a good time as I'm doing this, like I'm still gonna have the same work. Like the work is the same, the number of meetings is the same. But I find that I enjoy myself more and enjoy the work more, just kind of trying to have a bit more of like a let it go kind of attitude and trying to enjoy the process, even when things change, even when things are busy. So I would recommend that. Trying to, it's hard, but.
Awesome. And I guess we'll finish off with this last question. Based on your roles, are there any advice that you give to someone looking to get into a career you're applying for?
Definitely. I think the biggest thing is just be confident. If you don't have that confidence in yourself, people can tell, and it's difficult to have confidence in someone who does things who that. I remember going to school, starting rotations. The first rotation I did was in family medicine, and I went in. My first patient ever was, the pregnant. Well, what advice do I have to give you? I don't know. It's an experience I will never have. But it's just about being confident, and people can tell when you're uneasy or questioning yourself, and you can tell. And then I think again, it's okay not to know, and it's okay to tell that person. I think they'd rather you tell them the truth and say, look, I want to go back and ask someone, I want to go look at something, as opposed to only learning words and then trying to come up with an answer. It's just be confident, because if you're not confident in yourself, at the end of the day, it's hard for other people to be confident in you. And then the other thing is just try. It's no harm, no foul. Try a different role. Try, applying to school, even if you think you're not going to get in. You don't know at the end of the day. Try, put yourself out there. Because if you don't, you never will.
Similar to what Matt said, is that you don't know what you don't know. So I think if you can take advantage, if you are here, right, opportunities to really get involved in these types of settings, shadowing. So similar to me, I flipped to the counter side and let me learn more, and I went and shadowed to learn more. Mentors as well, mentors are so important because they help to kind of give you insight in some opportunities that you may not have known existed. Whether that's through mentoring networks within your university, whether it's hospitals that offer mentorship or shadowing opportunities for learners and students as well, which does exist in many hospitals. But just taking advantage, like really direct your path, and the way that you can do that is networking, connects with people that can help guide you. Because sometimes the internet search is not gonna lead information that you need. Sometimes you need an actual person to help and speak to you and to guide you on whatever path you're thinking of. And help you kind of work through some things that you may not have an exact idea. But you can kind of describe the essence of what you're looking for. And sometimes having someone to troubleshoot with is so key as well.
Thank you. I think one piece of advice I have is, and I know everyone has a different level of comfort with this, but try not to be afraid to show who you are as a person and what you are passionate about. So I think that can help bridge connections in a more real way than just trying to put on like a professional persona and just, network at a surface level. And then it can lead to unexpected opportunities of like collaboration, learning things from others. So for example, as you might have noticed, I like Excel and Power BI. So I was having a conversation at just like a more social event for UHN employees with someone from a different department. She was like, oh, and I was like, okay, well, it was during the work day, so I was gonna go back. I was like, oh, and I'm gonna go back to Power BI. And she was like, Power BI, oh, like my team's been really trying to learn that, but we're, it's not going well, and wondering, would you all be open to sharing, your skills and, maybe do like lunch and learn. So that was a cool opportunity that just came about kind of organically. That's one piece of advice, and I think the second would be similar to kind of the mentorship element and networking is you're going to be working with, and you probably already are, with really excellent teams and people who have a lot of experience in their fields and in different areas. And don't be afraid to ask them about their career journey, about their challenges, about their goals. I just always find it's really helpful to learn and to see what they're working on. So at UHN, every year we have to do performance goals. So I had my goal setting session with my manager last week and talked about my goals, but then at the end of the call, I asked her, I was like, okay, so these are my goals, would you be comfortable sharing your goals? Because in my mind, like she's someone who's very experienced, very talented at her role, so it was just a good opportunity to learn about what she's thinking, and I'm like, oh, like, is that something I should consider longer term? And I think that people are generally open to, well, it depends on the situation, but generally people are open to sharing a bit more about their path, their challenges, what they're currently working on. And I always find it like a useful thing to learn about, and then maybe you'd like apply to my current thoughts or my current goals.
Great, thank you. Now it's your turn. Anybody have any questions they'd like to ask? For everything. That's fine. No, okay. I'll repeat the question.
Yeah, so I just wanted to ask, do you think at times our maybe your roles are very specialized? Like I know that took like a long time for you to get into a very specialized role, but sometimes you feel that maybe you fit into a niche and maybe the skills you have now might not be transferable, because right now when we see these roles and we want to go into a career path, we think that maybe we can do such roles at a young age, like maybe like right after undergraduate or something. But for you, like I think Matthew's role was more like he had a program, City of Life, where and then you went through it. But for you guys, it seemed like a very long progression. So like how you started in consulting, would you suggest something like that, maybe a more generic role at first and then you progress into something very specialized? Because at times if you fit into a niche, then you're kind of stuck. So I just wanted to ask, like, has that been a problem for you, or would that be a problem for like somebody who is currently like an entry level position?
Oh, I think it's a great question. I think obviously whenever, you go to school, the program where you're going through just that's the for, to prepare you for that role. Specifically for myself, we did, 10 rotations in our second year through multiple different areas of medicine. So you got, at least experience in a little bit, and you can figure out what you like, maybe what you don't like. And I do hear what you're saying, and I think myself going into cardiology, I've done an elective rotation in that, or else I wouldn't have had any experience in that. And I think it is daunting for anyone moving to healthcare in whatever capacity, is that, you know, you go from learner to provider, and you're afraid of that bridge. But I think, and I'm sure they can attest to it, that whatever role you do start, there's always safeguards in place. There's always people there to teach you, to train you. You're never just thrown in alone. Everyone's been there. And I think, you know, everyone's well prepared to teach and to bring someone on to help. And being within a niche, I think, you know, there's always opportunity to change. I think when you start out, you know, whether it's a generic role or something a little bit more specific, you learn what you like, you learn what you don't like. And again, when you switch or go into a different specialty, again, the same safeguards are there. Whether you have 5 years of experience, 10 years of experience, whatever you switch into, although you're new and, you know, you have that backup experience, there's always a safeguard in place, and you're never just thrown into the fire. And I think that's one of the interesting, you know, cool parts of healthcare, is that really whatever you're interested in, there's a role. Specifically, you know, there's always a role, and you can create whatever role you want. I think even our 3 experiences are all very different and also all very intertwined, and it's creating that role that you see you want yourself in.
Say OT, occupational therapist, we graduate as we call generalists, right? They don't call ourselves for specialists in anything, so you know, a little bit of everything, not a lot of one thing. That's how the program is set up, to really guide, to really explore where your interests lie. And I would say my advice has shifted over the years, with my experience in that. At first, I was like, you know, even for myself, it's like, okay, get that job, get that full-time permanent, and start your pension. I'm like, you're so young, just relax for a second. So it's really about really just exploring, as you said. I would not recommend being in one position and then set specializing so early. I think if you have a certain passion or interest, for sure, continue to focus your energies there, but if you're still exploring, there's so many different areas and settings within this hospital itself, but even within OT world outside of the hospital setting. And I would say, I would encourage you to really explore, because you just don't know how the role might shift and change. You can find yourself in emergent position for OT, something that where it didn't exist. And that's what the program really highlights now, is called the LEAD program. And that's where students or OT students are now placed in positions that don't typically have OT roles. And they work to kind of shape the role of OT supervisor support them. So what I would say is that if you are someone who's still not sure, I would encourage you to really explore, take on a casual position, do a little bit here and there in different hospitals, get a sense as to what you want, and then figure out kind of your next steps. But I would say that shifted for me over the years. I definitely was the one who jumped in. It took me 15 years to do something different. And then I've been running since. So I would say, I agree with you, is that try not to get pigeonholed if you can, really explore possibilities.
Thanks. It's a great question for sure, and I think, again, as I mentioned earlier, like consulting is a good way to get a wide variety of skills and a like broader sense of what's out there. I also think it can be beneficial if you're not sure to try and go to a like mid-sized or larger organization, where then you can connect and learn about what's out there, as opposed to like a very small company or small organization. And I think it also depends on like the skills that you're applying in the role, because some skills can be like really easily transferable. So for example, like in data analytics, there's lots of opportunities in pretty much all industries, you know, in the public sector and the private sector. So if you're not sure, then maybe it's more about like focusing on the skills that you want to develop and ensuring that those are transferable into different industries or different workplace settings.
Thanks.
Right there.
Hi, Matt, I think you mentioned that with your training, you had no placement in both Northern and Southern Ontario. Correct?
Yep.
Yeah, I thought that was really cool, and I wanted to know your insight, and then also your focus as well on what was the biggest takeaway from having been seeing different geographical and patient populations, how that impacted your training, as well as your future profession, and do you see that model being integrated into other like professionals?
No, another great question too. But yeah, no, so the University of Toronto, there's a PA program, during a consortium with the Northern School of Medicine also. So exactly that, so they do it because obviously there's, like you allude to, there's a lot of different discrepancies in healthcare needs based on northern and southern Ontario. So U of T, again, they split the provinces, for the formula to split it up. Aurelia was technically the most northern city of that boundary, so I did most of my, 5 rotations in and around Aurelia, and then after that I went to Thunder Bay. And I was there for about 4.5 months, I also did one in Sudbury as well. And I think it's taking that experience and applying it to whatever patient care you're in and understanding the different needs, different populations you're serving. For example, I did a family medicine rotation in Thunder Bay. It was through an Indigenous health partners group. And the communities they served were actually mainly blind communities. So I was fortunate enough to do, it was 3 different day trips on a blind charter plane way up north to a community that was only accessible from an ice road 4 months of the year. And after that it was strictly fly-in. And being there, you really see just the different needs in itself, and understanding that, healthcare, medicine, there's certain conditions for certain, medication and whatever. But the needs of the actual patient is always going to be different, and addressing that and realizing that, what works for one patient population doesn't work for the next patient population. And being open to recognizing that, really is impactful. And I took that experience with me, at Toronto Western, and around the area, there's a lot of different patient populations. And again, a lot of different needs, with healthcare, with how they, look at death, how they look at their own healthcare, things like that. That you take a little bit from each experience you have, and kind of apply it to the next, and strategies that work, compared to strategies that don't work. Yeah, I answered your question.
I would say, the OT program doesn't have a requirement, but I would say there's lots of opportunities to go internationally. For placements, there are OT students that have gone to India, they've done Barbados, they've done Trinidad, Nepal. So there's been many experiences, Northern Ontario as well. But not a requirement for your program, but definitely lots of opportunities to support it as well. What I would say that the value of these opportunities is the concept of cultural humility, and it's really just being able to learn from others who are different from us, right? And being able to bring that knowledge back to our day-to-day, I would say very applicable in your working world, in your career, in that all of us are very different in this room, as you can see, right? The representation of where people come, their stories, their histories, and how we learn from various experiences is very important as well. So I think the concept of cultural humility is very the essence of those experiences, and I think that's present throughout healthcare. I think even it'll be more harnessed over the years to come as well.
Perfect. I must say time is flying, so I think we have time for one more, as Jackson's hand up.
Yeah, sure. This question's for Natasha. I found it really interesting that you were integrating like data analytics with kind of these newer initiatives like the social medicine program. When you have like patients or people that you're trying to analyze that maybe have like missing data points, like you said, they don't have a permanent home, what are some challenges that are associated with that, and kind of what are solutions that you guys come up with or that you're thinking of implementing?
Yeah, that's a great question, very relevant to social medicine. So most of, UHN's data is housed in our electronic medical record and we use Epic. And the challenge with that is for some demographic information, especially related to like housing status and also primary care provider, it might not be updated. So it's actually really hard just using administrative data to determine whether someone is experiencing homelessness. Because folks, when they come in, if there's an address listed already on the patient's file, they might just assume, okay, there's an address there, great. But they might not know that actually, they were evicted a few months ago and have been like couch surfing since then. So there is a gap with updating data. And then there's also instances where folks will just list the address of like the shelter where they're currently at, and then the person writes it down and then moves on, so not knowing that that's actually a shelter, it's not a permanent home. So there's some gaps in data quality, just kind of inherent in Epic. So to analyze or to try and like identify these populations, it's multiple like steps of analysis, including, like what I will do is merge the addresses with this view front of like shelter addresses, to see if there's any matches. It will also look in the ED, there's actually a diagnosis of homelessness. And so it will look to see if the patient has any diagnosis of homelessness, which could also indicate that they don't have a fixed address. So there's some like mitigation strategies, but another current challenge that we face is being a new program. What is the data that's currently captured on Epic is not customizable to the data that our community health workers and our social medicine team collects. So there's been a lot of work with, in which that whole team devoted to Epic and like our electronic medical record system, and trying to develop those tools so that our team, our frontline staff can easily kind of capture the data that's relevant. And as Miles in the audience knows, currently there's a lot of kind of Excel files, like some information here, some information there. So a challenge that again, we're working on addressing, and I'm hopeful that will, you know, in a year from now, being able to pull everything quite easily from Epic is this kind of disparate data sources. That answer your question?
Yeah, thank you.
Awesome, so it is 3 o'clock, so I think that brings us to the end of the formal panel. So please join me in thanking our panelists. So we, and then I'll be back to get any questions about research day or anything, anything. So, yeah, thank you all for coming today, and again, thank you to our panelists.
Thanks for having me.
Thank you.